As mentioned in the previous videos, the United States is the only industrialized country who spends a fortune on healthcare expenditures, including the fact that there are still millions of Americans who are still uninsured. An overall 78 million Americans lack health insurance, of which 37 million have no coverage whatsoever, while 41 million experience gaps in coverage. We have seen two countries who've expanded UHC into their society and made astounding progress in quality of care, access, administration aspects, and financial benefits.
When Molly was in a car accident in Part 1, she was in financial debt after being released from the hospital. Only to her debt. But imagine if they weren't there to help her out. What would have happened then? What else could she have done aside from having chunks of her paychecks taken for the purpose of medical bills? She was lucky. Not many people have that kind of luxury. But if there was a system to which we as a country developed universal health care, do you believe that this could have helped many Americans save thousands and thousands of dollars? Kind of like in the United Kingdom or in Canada. In spite of all these developments, the United States has made the ACA and MCO plans. Millions in this country who still seek for standard health care face financial hardships with out-of-pocket costs. However, the idea in building universal health care is not only to ensure millions the ability and access to care, but that they also utilize their options. It is also the matter of recognizing that health systems should not only improve health, it should also be affordable and manageable enough so that the public won't suffer any financial risks. The purpose of this video is to hopefully bring light to others on the fact of how much financial burden can be lifted off the ground if the ACA adjusted to universal health care. To start off, it is good to point out, as reference, that the US spent roughly $3.6 trillion in 2019 on healthcare per capita. In other words, per person, per spending. For many reasons, the website called Healthcare Drive claimed that one of the reasons in an increase of healthcare expenditure was due to Medicare's increase in requesting prescription drugs. They also claimed that due to this incline, 2018's rate of spending rise from 4.4% now to 5.7% at the end of 2020. As we get into costs, the first thing we'll be mentioning are the costs in pharmaceuticals, also mentioning hospitalization, and finally premium costs with out-of-pocket expenses as well. But first, in terms of pharmacy, our demand in medical drugs has rapidly escalated since the late 90s till today, over a 2 million jump in numbers. Usually each year, new developments for prescriptions are released into the market to fight off infections and diseases. Normally, when this process happens, the set price for new drugs are relatively high, whether it's research and development, FDA background checks, pharmaceutical companies, and etc. Reports from the article Pain Pill to Swallow from the Ways and Means Committee reported that in 2016, US spent $457 billion combined in retail and non-retail drugs. Within that budget, Medicare expenses itself was roughly $130 billion, and Plan D expenditure exceeded up to $99.5 billion. The author also mentioned how the US average drug prices are at least 4 times higher than compared to other countries who actually have universal health care. Adjusting the prices by reduction could save our GDP towards healthcare by the billions. So then the question becomes, well, if we transform into universal healthcare, what kind of savings and costs will we see? Well, according to that was done in 2020, that was posted on PLOS Medicine, that if we conduct a system of Medicare for all, we could be looking at saving over $200 billion a year on prescription drugs. Now, looking at the cost it goes to hospitals as of right now in America, when it comes to hospitalization expenses, out of $3.6 trillion capita spending, roughly $1.1 trillion is spent on hospital services. The annual charge fee for staying in a hospital can range from $10,000 to $16,000 depending on the time needed to stay. To give a quick example of how much overcharge Americans face, in an article from the Yale School of Public Health, the author claimed that in Spain the cost of hospital bills for giving birth would roughly charge about $2,500, whereas in America the fees for giving birth would equally close to about $15,000 after tax. So far, private health insurance pays for approximately 34% for hospital care. Out-of-pocket costs roughly 11% out of the total, while 18% are covered by other sources, including all other public health insurance programs and MCOs. Implementing a universal system could lower costs by the billions, like they did in pharmaceuticals, to which hospital fees would be reduced by 49% and clinical service fees will also be reduced by 31%, resulting in an approximate annual savings of $100 billion. And finally, we'll talk about premiums, out-of-pocket expenses, and deductible fees that can put a strain in people's wallets, especially those who've developed chronic illnesses or have those in their families that have it, or are going through the process of treatments and countless appointments with specialists. Depending on the insurance you have, most private insurances require premium fees and deductibles. It also depends on what sort of coverage your plan can provide. It could be an 80-20 ratio. It also depends on the quality of insurance you have, or if it's individual or through your employer. The website eHealth claimed that in 2018, the average premium costs alone for individual health insurance premiums, monthly fees, approximated close to $440, and for a family insurance plan coverage would averaged in 2018 to $1,168. eHealth also mentioned that within the same year, the average deductible charges for individuals were close to about $5,000 and approximately $9,000 for family plan after tax. Each passing year, these numbers for premiums and deductibles rises higher and higher, that it has caused severe financial barriers in this country. That is where universal health care might alternate these costs and drive them down, or take other countries' policies as examples to where taxpayer dollars could cover the fees and we as society are left with a small monthly charge. Take, for example, the United Kingdom. As of right now, the United States is ranked lower than 30 countries in standards of healthcare performance, quality, administrative efficiency, health outcomes, and accessibility. Healthcare spending in the United States during 2017 was $3.5 trillion, or about $11,000 per person. Each day, more and more, these numbers grow higher. However, by 2017, these costs are expected to climb to $6 trillion. That will be roughly $17,000 per person. America's system of healthcare is on track towards becoming a universal healthcare system. Each decade or so, progress is made little by little that we have a set of regulations like other countries established universal healthcare. It is just that we don't call it that. It's sort of a taboo characterization. All in all, for our sake, as a country facing an infection crisis as of right now, we need new changes created to look out for our fighting Americans. It just takes time. But hopefully by then, rates for insured Americans will increase more and more than what we have witnessed these last 3 decades. Hopefully we do come to an age where we might reach universal health care, but who knows?